welcome back. It's nice to have you here with us. And we're talking about heart health. So on today's show, we're talking about cardiovascular diseases or heart diseases, which we're learning remains the world's #1 killer, resulting in 18.6 million deaths a year. So it has many causes, from smoking, diabetes, high blood pressure, and obesity to air pollution. So for the 520 million people living with CVD, COVID-19 has made things a lot worse, as they have been more at risk of developing severe forms of the virus. And then in addition to that, many have been afraid to attend routine and emergency appointments and have become isolated from friends and family. So how do you handle your heart in a delicate situation such as a COVID-19 pandemic? Well, today on Healthy Thursday, we will be talking to cardiologist with the University of Ghana Medical School, Dr. Joseph Akama. He's going to help us take better care of our hearts. Good morning, Doc.
Good morning. How are you?
I'm very well, thank you. I love your smile. It's such a...
It keeps me going. The smile keeps me going, and I hope it will keep everybody going. I'm happy to be with you and your co-host, and thanks to Joy for having me.
Oh, thank you so much.
All right, so the smile that keeps you going, does that have anything to do with the heart? I think if you smile, your heart is healthier?
Certainly. If you frown, you have the bad hormones get on you, stress hormones. So I keep a smile. I try to, even in the most difficult instances, I try to keep a smile. When I'm sharing difficult moments with my patients, I let them know that this is not the end of time. We have to keep going. And you realize that every smile you give and receive, there is something that comes in you that helps your heart and helps your blood pressure go down.
Right.
Yes.
Okay. Well, we're going to keep smiling for our hearts. So let's talk about, heart health and heart disease and the fact that it's still, the world's #1 killer. I didn't know that. And I don't think that it's something that you would automatically assume, would be something that's killing people. Why is it still the world's #1 killer?
Well, it's amazing that we really haven't highlighted this a lot into the mindset of many Ghanaians. The problem lies on the fact that heart diseases are related to what we eat, how we behave, our attitude, lack of exercises, the stress level we're going through. So when this happens, then it is difficult to know when do you stop to the stress you're going through. Some of them are self-created stress. And you remember I talked about stress before. We said the bad hormones coming, cortisol, adrenaline. All of this increase the person's risk of getting high blood pressure and then diabetes. So the stress leads to heart problems, increase high blood pressure, increase diabetes. So at the end of it, we're just getting through a very unending circling problem that we cannot contain. And if we look at the developing countries compared to developed countries, they have advanced their health systems. The developed countries have advanced their health systems to cater for the NCDs, the non-communicable diseases, including heart diseases. Whereas the developing countries are still battling with infections, diarrhea, water problems, and then malnutrition. At the same time, we're battling with hypertension. So our health systems are not well developed to the point where we can take care of the non-communicable diseases properly. For instance, you guys know very well, you know very well the problem that came with this COVID-19 and ICU care. That really blew us apart because we just realized that, no, we're not capable of taking care of patients to that level of critical illness. And we have to develop it. So based on that, the heart diseases, unfortunately, are affecting developing countries far, far more than the developed countries. Obviously, because we cannot take care of it, and we have the risk factors increasing. Fast food is coming up, a lot of salty food, a lot of Okada. Instead of walking from Legon to airport, we take a trotto, we take Okada. So the lack of activity, physical activity, increased salt intake, stress levels. We don't smoke a lot in Ghana, but I always say when you go to villages, maybe they're smoking a lot there. So all of these risk factors are increasing. And the World Heart Foundation estimates that 31% of all deaths per year are attributable to heart conditions.
Wow, that's a lot of information. So, okay.
Yeah.
Yeah.
And then in addition to all of that, then we have COVID-19 comes in and it makes the situation worse. How, again, are you saying that COVID-19 has aggravated and made the situation of people living with cardiovascular diseases a whole lot worse?
Right. The COVID-19 situation has really not helped us at all. One is hit our economy very badly. That's exposed our health systems that we know we are not capable. We have to work hard to upgrade our hospitals, train more people. But for the patients, for the Ghanaian population, it has really hit the cardiovascular disease patient. The one that we haven't really understood is the fact that patients are afraid to come out to tell you that they are short of breath. Because the first thing you think about is what? COVID-19. They're short of breath, COVID-19. So the shortness of breath could be due to his heart failure. It could be due to angina. It could be due to blocked arteries. But he will not come out. So he will stay in the house for a long period. That will make his heart condition worsen. So COVID-19 has several problems related to the cardiovascular diseases, especially heart diseases.
Okay, so in this particular instance, you're saying that because of stigma, the people living with CVD are not coming out.
Exactly. Because if you come out and you come to the hospital and say you are short of breath, what do you think they'll do to you? Isolation.
Yeah, immediately.
Immediate isolation.
Yeah.
So they won't come. Okay, they won't come.
No,
and
but
we've had instances like that.
If you have COVID too and you don't go to the hospital, your situation is going to get even worse.
And that is why when they come in, it is too late, either too late because of their heart condition or too late because of COVID. Yeah. So COVID by itself can infect the heart and cause pericarditis, inflammation of the cavern of the heart, or myocarditis, weaken the heart. COVID by itself can cause a lot of clots in the system. And it's estimated that a lot of people, up to 30% of people with COVID-19 infecting their lungs have clots. So the clots alone can hit somebody and he'll collapse, and that is it. And it affects the heart, the blood supply to the body. Apart from that, the stress of COVID alone increases your blood pressure, increases the bad hormones. So causes a lot of rhythm problems. And the COVID, by infecting the heart muscle, can cause rhythm skip beats. People have heart block, palpitations, rhythm disturbance, and then they have sudden cardiac death. In addition, the medications we give for COVID, some of them have deleterious effect on the cardiovascular disease. For instance, there are some antibiotics that we give to patients with COVID that can cause something we call QT prolongation. So especially the hydrochloroquine that we heard about up and down about it, it causes a lot of problems. So it has side effects. So if you just hit yourself with hydrochloroquine, you might die from a heart problem rather than the COVID. The COVID is not going to be a problem, but then you've caused a new problem. And as I said, the biggest one that I really want people to understand is the fear. So now we have to, that is why the World Heart Foundation is emphasizing on us connecting. Use your digital platforms. Call people, video conferences, video consultation. Use your smartphone and call people video. And then you can consult the doctor. So a lot of doctors are improving on their access ways of getting to patients who cannot come out or are afraid to come out. And the patients have to take the initiative to use their digital connections to be able to get help.
All right, so in one breath, you have people avoiding the hospitals because they fear that if they get there, they're having breath issues, they'll be isolated, and then they will say they have COVID-19. Then after all of that, you're also saying that the medication that is given them sometimes can also, compound their situation. But then, on the back of all of that, as if it's not terrible enough, and it turns out that if you happen to have cardiovascular disease and you get COVID, your situation gets worse because you have underlying conditions.
Yes. Yes. And then the COVID can affect your heart. Hit your heart so bad, your heart will become weak, or give you rhythm disturbance, or cause the covering to be inflamed. So this is where we're dealing with. So it has a multifaceted problem related to the COVID-19 infection.
Okay, so Doc, I mean, knowing that this is what has been happening over the past few months, that people with heart disease are not wanting to go to the hospital, have we set up, because you're talking about video consultation, which is great if it works, if your doctor is accessible, if you can actually do that. I haven't really seen, Israel, I don't know if you have, I haven't really seen any, health services, offering, appointment slots for video consultations and things like that. So is that, is that like a sustainable thing? Is that something that's happening and an option that is readily available to patients?
Yes, I have used it. So I'll tell you firsthand, I've used it. And a lot of practitioners are also using it. So the doctors who are not willing to go to that route, maybe Medical and Dental Council have to come out with guidelines. Maybe the Minister of Health and all its branches have to come with guidelines as to how we can contain patient confidentiality, and then in the light of this stealing of data. And I think the data management system or the commission that is involved in data sharing has to also come in. But having said that, telemedicine is the future. Why is it so? We have access problems. For instance, I've been able to consult with doctors in Bolgatanga. A friend of mine called me. He has a patient lying there having trouble breathing. I said, do you have an ultrasound? He said, yes. Okay, put it on the chest. He put it on the chest. Right away, I was able to determine what was going on with the heart, and we're able to take care of it. So these are, and my colleague, Dr. Doku, is working with all of these possibilities to see how we can improve the access, because we don't have too many cardiologists in Ghana. So how are you going to, like we say, be divisible into twice? You cannot. So we have to be innovative. That's where Minister of Health has to move ahead. Medical and Dental Council has to move ahead and direct the physician. So I can be in Accra and yet consult with multiple places. How do we do that? We have to use the digital platform. Right now, money is gone digital. Why is healthcare not going digital? So we have to look at this. So I think the software developers, the companies that deal with communication have to think about the way of protecting patients so we can be able to comfortably see them remotely. And we've been doing it. I consult patients, I call them directly at their home. Apart from that, doctors are also becoming innovative by going to patients' home. So we are improving the care, but I think all of these have to be put in the context of patient confidentiality, making sure that you protect the patient's data so that it doesn't get into the public domain.
And also, I guess, the setting up of payment systems that work.
Exactly.
Yeah.
Well, the payment system already is rocking very well. We have mobile money. So doctors charge through mobile money. You pay me before I consult. Or you pay my clinic before they consult. And then those who come there, they can even have point of care payment systems where they can just slot in their card and pay. So the payment system, I think, has gone faster than the virtual consultation. The point where we have to get to is how do we really capture that information and document it so that it can be a legal document, it can be a future reference document for other doctors to refer to and stuff like that.
Good point there, because there has to be continuity in your medical records.
Exactly.
Okay. So let's move on to, a healthy heart. So if you don't have COVID, and then if you've had COVID, you talk about lifestyle, you talk about, the way we do things, the things we eat, and the fact that all of those things contribute to, having a healthy heart. So I have two questions for you. The first one is that we all know these things. We know that, our lifestyle affects our hearts, whether we exercise or not affects our heart. Why do you feel that a lot of people just don't take it that seriously? And secondly, how do we, get to a point where we're, preemptive? So we're in a how would you put it? The English is not coming.
We prevent.
That's the word. We're preventing, getting into situations where we have heart issues.
Right. So the first question is really a heavy loaded question. It requires psychiatrists, psychologists, and
sociologists, anthropologists,
everybody to come in. Even all the pastors and
the spiritual fetish priests. Yeah, that's a good one.
Exactly. Because you see, it's a habit problem. For instance, if a young lady is about to wed, and she thinks that she has to look in a certain way, there's a motivation.
Yeah.
The man also is also motivated. So they have a short-term goal. So they can work hard to get there. What we need to do is to translate that to long-term goals. And that's the habit making that we have to. Apart from that, we also have this attitude of, I am doing well, therefore I have to drive. I am doing well. I cannot ride on Okada. I can't ride even trotro. A lot of people don't. When I was a junior doctor, I used to take trotro from Kolebu to Adenta every day. Now tell a junior doctor to take trotro, he wouldn't. So the lifestyle has gone higher and higher to the level where people who used to walk are using Okada because status has changed. So we have this false exhibition, make appearance seem what they are not. And when we do that, we are going to be in deep trouble, and that is what is going on. So we have to have a way of encouraging walking. When you go to new neighborhoods, there are not even good gutters, not to talk about walking places. They are creating good, nice, environmental friendly, so-called environmental friendly neighborhood. But do you see any place to walk? No. Do you see any place to even for children to go and play? No. Every space is taken up in Ghana. So the government has to sit up and say, what am I doing to my population? Government doesn't mean NDC, MPP. No, don't get me wrong. Don't go there. What I mean is we as a country have to come out with pragmatic assessment of where we are going with our health systems. Our preventive measures are not good. We have to come up with practical solutions. Why are we exercising less and less? Why are we not able to get involved in some of these health promoting activities? Because we know our diet is deteriorating by the day. So you can supplement with increased exercise. But I tell you what, those patients of mine who have taken up the mantle, change their lifestyle, start exercising, you see their blood pressure drop, you see their cholesterol drop, their outlook, they're more sexual, they're more engaging, they're happier. So there are a lot of benefits, and I'm not kidding you. There are a lot of benefits that come with changing your lifestyle, exercising, and making sure that you can keep it going. The question is, how do you keep it going? And that is where, if you can solve that question, then you'll be a millionaire. It's a very difficult situation. People have gyms, they join gyms and then pay the people. You see the gym owners, they don't charge you per visit. They charge you 2 years.
Yeah.
Because they know you won't come. So they charge you 3 years. They'll say,
Yeah.
I will discount you 3 years. He's gone to the bank. He's going to play golf. He's bought a new car with your money. He knows you come, 1, 2, 3. The next 3 years, you're not going to show up. And then he'll go to another person. So it's like a Ponzi scheme. But if you are to be going every day, can you imagine if the gym members were to go every day? They can't have space for them. You see, so they know the behavior of the people, and we have to be able to turn it around. So we have people who organize local exercise programs in Legon. People go to Eburi. That one, once a week, climb up the Eburi thing, I like it for relaxation, but it's not a good exercise program. You need to exercise daily, 30 minutes every day, okay? If you want to lose weight, you need to go to 60 minutes, about 45 to 60 minutes every day for about 5 days a week. It's not just Saturday morning, you go and climb the mountain, come down, eat bankun fufu with 2 beers,
palm wine, pito.
Palm wine, and then you come home and then belch and sleep. No.
Doc, I have a question for you. I mean, so we've seen, you know, articles and studies, you know, that have said that sex is a good form of exercise. So if you're talking about somebody needing to lose weight and they need to exercise for 60 minutes, you know, to be able to do that, you know, can you factor in the amount of time you spend having sex as part of your exercise quota?
Well, once people are consensually married and live together, sex has multiple benefits. One, it's good exercise because the whole body is going to exercise. 2, it relaxes the person. 3, it brings down a lot of the stress in the marriages and relationships. So I think I'm not endorsing that you just go around doing things that you're not supposed to do. But once you're married, it is a good way of keeping the marriage. And you remember one of our prominent writers and play, what is Ebo?
Ebo White.
He's been talking, Ebo White has been talking about it lately. A lot of old men like listening to his story.
Okay.
Yeah, so it is true that sex helps a lot, but it has to be done in the context of you're marrying the person and then keeping the relationship going.
Okay, Doc, let me come in here. So in other words, what you're trying to say, and you're preaching, in effect, that you can have all the sex that you want, or anyone can have all the sex that she wants, but she still has to exercise.
Oh, yes. Sex is just one little bit. It's just a little bit. It doesn't contribute, assuming you're going to get exercise from, let's say, you need 100% exercise per week. Sex should be like 10%. It doesn't contribute much.
Okay.
Okay.
Happy, Israel?
Yes, I'm
okay.
very happy.
Doc, so now I want to talk to you about psychological factors, you know, that affect our hearts. You know, because so many times, you know, there seems to be in our conversations a disconnect between what we think and the way we feel, and the ability that the impact that it has on our health, or on our heart health, for example. So can you just clarify that for us? How much of an impact does the way we think, the things that are worrying us, the stress and the issues that we're facing in life, how much of an impact does that have on our heart health? And how is it important that we get psychological support so that we're manifesting a healthier, you know, life physically?
Mm-hmm. Yeah, so if you look at the heart, even people who haven't studied anatomy, it's amazing. When you ask them where's their heart, they point to the left side. Okay, you go to a village, Makuma goes to the left side. So there is some psychological bearing, there is some psychological relationship. When somebody is having a heart attack, he knows that he's going to die. For some reason, the heart is able to communicate with the person. When you're in love with somebody, the heart tickles. So psychologically, there is a relationship that we have not been able to explore. Maybe it is through the hormones and blood, the adrenaline, sympathetic, parasympathetic. These are all nervous system stuff. But having said that, thinking, your well-being has a bearing on your attitude, the way you think. If you think negative, negative things are going to happen to you. If you think positive, positive things are going to happen to you. Why is this so? There are certain hormones that are called endorphins. The more positive you are, the more you help people, the more you smile, you improve the levels of endorphins, and these have direct burden on your outlook, your energy, your heart health, your blood pressure levels. Now, negative thoughts, bad thinking, a lot of stress leads to increased cortisol, increased stress hormones, including adrenaline, which are bad for the person. So, what does it lead to? Increased weight. Even though you're not eating much, you're going to be increased, your weight is going to go up. You're going to have the chance of getting to be a diabetic if you don't stop thinking bad. And then you become more depressed because the more you have bad hormones coming to you, stress hormones, the more likely you're going to be depressed. Depression is directly linked to heart conditions. So people who are depressed will try to uplift them, try to get them engaging, try to let them get out and talk more. So we have to move away. If there's something bothering you, these days we keep to ourselves a whole lot than the older people used to do. The previous generations used to have family support. You are far removed from your family and you are struggling by yourself. You need to have a community, and that is why if you look at the World Heart Foundation, they're emphasizing the community approach, where we keep each other, we try to help each other, and then help people cope with their stress levels. At the government level, they had to come up with some strategies to help diffuse tension in Ghana whenever there's tension coming up. Whenever there is a lot of stress coming in, the government has to come out with or the Minister of Health has come out with a program that can diffuse the tension. That way, the anxiety level goes down. People will not go about destroying things because they are so anxious, and then they get injuries and stuff like that. But I think this topic is very wide, and it has a lot of psychological and cardiometabolic implication, which means that the way you think psychologically, the way you behave psychologically has a direct bearing on your cardiac and metabolism. And the metabolism aspect is the weight gain you're going to have, the increased cholesterol, increased diabetes, increased blood pressure, increased risk of sudden cardiac death because you're going to have rhythm disturbance and then you die suddenly. But the flip coin is that if you are able to undo some of this stress, you reap a lot of benefit. And that is where we have to be emphasizing on.
All right.
Know who you are, know how you can rethink things, lessen the stress level that you have, and then keep on going and smile.
Okay, Doc, so they say that the simple things in life are free. And you've alluded to some of them, but I'd want you to take us through some of the things that we can do if I can't afford to get gym membership, and if I get to do the other things that you're talking about. What are some of the basic things that I can do? And I'm saying this because I know you're a grassroots kind of person. I mean, you know what the situation is like on the ground. What are some of the simple things we can do? Lifestyle choices, really.
Yes. So I will just link it with a question we didn't delve into when your co-host asked about the preventive measures.
Yeah.
So I think the simple things that for now, first and foremost, know yourself. Begin by assessing your numbers. What is your blood pressure? Very easy to know. And you can monitor it regularly. What is your cholesterol level? And these days, you can go into the internet and find out the cholesterol the doctor told you is normal. Is it truly normal for your age, for your size, for your gender, for your blood pressure level? Is it true? And then thirdly, know your sugar level, okay? Once you know these numbers and you're able to track them, and at the appropriate age, know what type of screening you should do for cancer, colon cancer, rectal cancer, prostate cancer, breast cancer, cervical cancer. These have to be screened periodically. Those are basic things you can easily do without running and jogging and stuff like that. Now, once you get those, begin with a simple attitude of try to relax. Take some time off. Have you seen Ghanaians go on vacation regularly? Maybe more than Ghanaians. When they take a vacation, they're going for a funeral, okay? And go and stress themselves and come back and continue working, okay? Multiple jobs. Then the vacation, they leave, they even work harder than the time they were in regular work period. So we have to develop that culture of, let me just take a break. Nothing is going to stop. But you see, when you are in a big position and you leave away for a month on vacation, by the time you come, things will be so spoiled, you regret you went on vacation. So a lot of these big people don't want to go on vacation. But those of us on the ground, go on vacation, take a week, just relax, just go to the village. You're not going for a funeral, just go and walk around, play back your childhood memories. These will help you calm down. Next one is to exercise. Walk daily if you can. Don't join a gym unless you are committed, because that's money thrown away. I'm not against gym companies. Don't come after me. But they are making money off your back. So start the exercise. Make sure you can maintain it before you join the gym. If you can organize a neighborhood program, don't do it just to show off. Be serious. Make sure you pull 4 people together. You walk in the morning, 30 minutes, come, take a shower, and go to work. Those of you who work a lot, try to get equipment in your office. If you're capable, get a bike, stationary bike in your office. Once you're doing your Zoom meeting, you can be riding. So all of these are things that you can easily incorporate into your life. Standing is very key. Newscasters, sometimes these days we see you standing, which is really good. But if you sit for too long, it is not a good thing. So periodically, 1 to 2 hours, stand up. And these days, there are even desks that will help you. You press a button, the desk rises, and then you also stand, and then it will come down again when you want to sit down. So these are simple things you can incorporate into your life. Doctors, nurses are so stressed, you have to take break. There is something called burnout. And burnout is not just with the doctors and nurses. Everybody gets burned out. The police get burned out. They are being bombarded left and right with armed robbers. They are stressed. Soldiers are stressed. So everybody is under tremendous stress. You have to take some time back out of the whole chaos, relax, take care of yourself, screen yourself. If you have not seen a doctor in a year, that is a bad thing. If you have not seen a doctor in a year, that's a bad thing. Go get your screening, get examined, talk to the doctor, make sure you know your numbers. And then a patient of mine didn't have any problem. And guess what? He kept on coming. And 5 years later, he developed diabetes. If we didn't know, he wouldn't have been aware. And he quickly jumped on it, and the sugar is controlled. So this is a very good way of monitoring yourself. So we knew when the diabetes started going, we started warning each other, your sugar is beginning to go up, your sugar is going, and I'm giving you as an example myself. When I came to Ghana, everything was quiet. But as I got older, my numbers started going up. I could tell my blood pressure started going up, my sugar started going up. And I had to take measures to cut things down. And that is how you can know. Get to know your numbers, start walking.
Now, another thing I'd want you to touch on has to do with the eating habits, as in the kind of diet we should be taking in to avoid getting some of these heart problems. But we have some people calling us. We have a first caller, but you can also call. The numbers are on the screen: 030-221-1691 or 2. We have Maxwell calling from Medina. So Maxwell, you have the cardiologist online. Is there any question you have for him?
Good morning to you and good morning to the doctor. I took the COVID-19 jabs at Medina for clinic, and I think 2 days today, I'm feeling pains on my leg, on my upper hand and headache. Is it normal or something is wrong, please?
All right, so this is not quite a COVID conversation, but since we have the doctor online, I'll just put that to him. Dr. Kama, can you help him out?
Yes, I didn't get him. Did he say he had COVID-19
No,
diagnosed or he has
he's taking the
tested
vaccine. Maxwell, you've taken the vaccine, right?
Is the vaccine? Oh, yes. So the vaccine, it is a normal, oh, no, let me not say normal. Let me say expected reaction from your body. What happens is when you get a vaccine, your body has to produce items we call antibodies. They are like soldiers that are preparing your system to fight COVID-19 should you get the COVID-19. However, when in the production of these, there's some inflammation going on. So just think about it like Star Wars. You know, when you watch Star Wars, whatever is going on there, something is happening to your body. And so what we advise is that when you get COVID-19 shot, you're likely to experience some symptoms. You take paracetamol, okay? Drink a lot of fluids. Don't get anxious. Don't get anxious because you read all about these stories about the vaccine, the side effect. I had side effect. When I got COVID-19 injection, I had bad side effect.
Yeah.
But I had to take paracetamol, drink a lot of fluids. After 3 days, I started taking Motrin to help me because it was so painful. But within another day or two, things went back to normal. So it will happen to some people. Some patients do not get any complaints.
Yeah.
One of my patients really had severe chest pain, palpitations, sore throat. And we nearly admitted the patient. But with counseling, with a lot of fluids, light soup, the person got better, paracetamol, and we started laughing about it.
All right.
Okay?
Okay.
So it is possible.
Okay, so Maxwell, don't get too anxious. If you get anxious, it's not good for your heart.
Yeah.
Let's go to Kwabna, who's calling from Latte. Hello, Kwabna.
Hi.
Yes, you have Dr. Akama on the line.
Okay. Thank you very much. Very, very interesting, very, very good program you guys are running this morning. My question is, so I've been, over the period, my pulse, when I do my check, I realize that my pulse is averaging 47. Is this something to worry about? My pulse level is 47. And then again, when it comes to exercising, will you recommend that you see a doctor before you start any form of exercise, or you can jump on any form of exercise? For instance, I can't run. I can do a bit of walking, but I can't run. But is it necessary, is it imperative that I see a doctor to recommend the form of exercise I should engage in? Those are my questions.
All right, thank you, Kwabna. Dr. Kama.
Okay, so sorry to hear about your inability to run. How old are you, sir? You don't have to, anyway, your name is on the
Hello,
screen.
hello, Kwabna. Can you give a range?
Let me answer you with his age. Some people don't want their age to be mentioned. But the reason why I wanted his age was to say certain individuals after the age of 40 onwards, in my view, have to be screened before they can go for exercise. Especially when you're older and you're going to start exercising, you may have to get screened. How do you get screened? You see a cardiovascular doctor, they do an ECG, make sure your heart is fine, and then they may do a stress test because some people may have underlying heart condition without knowing it, and then suddenly they start running and then they collapse. So before you engage, especially when you're older, try to get screened. Younger people start slow. And if you can't get screened and you're older, start slow and progressively go up. And we notice any limitation, shortness of breath, chest pain, then you go get help. Now, regarding what our exercise you should do, I think walking is very good, okay? Actually, running has some good aspects to it and bad aspects to it. It can hurt your knees and people can have knee trouble down the line. So if you can walk distance, stamina training is very, very good. So I would say if you're older, you've never exercised, get screened before you start running. If you're younger, start slow and then build your stamina up.
All right, great. Let's go to Kingsley, who's calling from Casper. Hello, Kingsley.
Yeah, good morning, sir.
All right, good morning. What's your question to the doctor?
Yeah, I really appreciate the program this morning. I was actually diagnosed of mitral valve regurgitation 2017. So from 2017 to 2021, this year, I went back. They helped me to run another test.
We can't hear you, Kingsley. You'd have to.
Yes, can you hear me now?
Yeah, please. Yeah, speak up.
Yes. So when I went back to the hospital this year, they ran another test and they said it's a rheumatic valve disease. So at the long run, they actually said it's not too serious. They sent me to another doctor. As it is, I'm actually having so much pain, so much symptom more than the way it was. Now I can actually have this BP up to 190 over 120.
Come again. You said BP of what?
190.
190.
Yeah, 190 over 120. And severe chest pain and back pain.
Okay.
Severe chest pain and back pain. For more than a week now, for more than 2 weeks now, I've been having so much pain at my left side under the rib cage, and so much heart pain.
Okay.
Leading to my neck, my shoulder.
I think I heard you say that you've seen a doctor already, but you
yes,
I believe
I saw them and they told me it's not serious. But now the things I'm having and the symptoms I'm having are just so much that I'm even so scared.
Yeah.
Because the doctors are telling me it's not serious, but what I'm having, the pains I'm having is so
you said the doctor is telling you that what?
It's not serious. That it's not serious.
It's not serious? All right, let's have Dr. Akama speak to that.
Even I can't even sleep because of my chest, my heartbeat at night. I can't even sleep well. The sound of my heartbeat can't even make me sleep.
Kinsley,
right.
Let's hear Dr. Akama. Yeah.
Yeah, Kinsley, I'm sorry to hear about these problems, but you have real problems. You do have real problems. But sometimes the doctor might not be at the level where he can appreciate what you're going through. So you have to go a notch up, maybe seek help from a specialist. What you're describing has multiple issues to it. First, let's deal with your mitral valve. Your mitral valve, they said you have rheumatic fever. What is rheumatic fever or rheumatic heart disease? Rheumatic fever ensues from having sore throat. Some of us were little, we got infected, we had sore throat, and then there's a bacteria called streptococcus. Once that gets infected, you get infected with that bacteria in your sore throat, it can release certain chemicals that will affect your heart. And then years down the line, your valves will start malfunctioning. So maybe that is what you're going through. Now, the malfunctioned valve can lead to enlargement of the heart. The enlargement of the heart can lead to heart failure. And then the heart failure can lead to other problems that you're facing. In addition, you've also developed hypertension, which is not related to the rheumatic heart disease, but the hypertension can make the rheumatic heart disease worse. So high blood pressure can make your valve leak more, and then the valve leaking more can create a lot of pressure, back pressure into your system, your venous pressure, then your intestines will be enlarged, your liver will be enlarged, and there'll be congestion. So in addition, you also give this pain from your neck down your shoulder. It could be from your heart, but more likely it's coming from your spine and your shoulder joint, maybe muscular pain. So I think my advice to you is, since you're having a lot of problems and the doctor doesn't seem to agree with you, go a notch up and then ask for more help. Go and see a specialist. Let them understand your system very well. Control the blood pressure. Let them control the blood pressure. And then sometimes when we control the blood pressure, everything gets better. Your heart gets smaller, your breathing gets better, and then the pain might go away. How about clogged arteries? You could have clogged arteries. You're afraid to eat. Maybe your cholesterol may have caused your arteries to clog up in your stomach, that whenever you eat, you have the pain coming up because of ischemia, lack of blood supply to your intestines. That is possible. So I think it's difficult to give you a direct answer, but first control the blood pressure, get a second opinion, and then they always tell people, don't be too anxious. Try to seek help. The anxiety, the perseverance of anxiety makes things worse. So calm yourself down, go get a good specialist who understand. It will be multiple visits because they may have to do certain tests, look at the heart, look at your blood pressure, change your medications, agree with them, work with them to take the medicines. Because if you don't take the medicines, the blood pressure is not going to go down.
All right. Thank you very much, Doc. And Kingsley, this is free advice that you're not having to pay for, even though you're enjoying the telemedicine. Let's go to Isaac. He's going to be our last caller. Isaac is calling from Copetown.
Yes,
So, yeah, Isaac, yes, speak with Dr. Kama.
Yeah, my problem is any slight food I eat, bean, fufu, bean, cocoa, immediately I eat, I feel sleepy.
Oh. You feel sleepy?
Yes.
No matter the food that you eat?
No matter the food.
Okay. And it's a problem for you. Let's speak with, let's hear from Dr. Joseph Kama. So Isaac has a peculiar problem. Anything that he eats, fufu, cocoa, whatever, he feels sleepy right after that.
Yes, so there is a relationship. It's not something that is not physiological. There's a physiological explanation.
Oh, okay.
Some people, when they eat, all the blood gets diverted to the stomach and the intestines. So you have a differential vasodilation so that the body's attention goes into the intestinal system. So the brain does not get blood. When the brain does not get blood, the brain says, go to sleep, okay? And then in an hour, when the digestion is over, you're active again. So it is a classic physiological problem. Why is it that some people experience it more? It's difficult to explain. Maybe there is a problem with your autonomic nervous system. Maybe that is your nature. So those people, we advise that do not eat too much. You eat little throughout the day. You'll be able to avert this scenario. Otherwise, you have to be checked to find out what is going on. There are people also, we find out they get chest pain, like heart attack, in warning for heart attack, when they eat. And that is also physiological because, again, the blood is diverted to your stomach and your intestines. The heart is crying, I don't have blood, and the chest pain comes on. So it is physiological. But I think go and see the specialists you should see are three. One, the GI doctor, the endocrinologist, and the neurologist. Okay? So these are three specialists. I don't think you have any heart problem yet. They will be able to help you determine what is going on. Especially the endocrinologist will tell you about the hormonal problems, maybe some hormonal problems. The GI doctor will be able to tell you whether there's a problem with your intestines. And then the endocrinologist. If they think you need a cardiologist, then you can go up to see a cardiologist. Sometimes the blood supply to your intestines could be a problem as well.
All right. Isaac was our last caller. But Doc, I'd want us to finish off, since we're talking about food, let's finish off with the eating habits. Some of the things we should be avoiding if we're to ensure that we have a good heart.
Yes. So eating habits is one of our Achilles tendon. We like food. We like the good multiple types of meat on the plate on a Sunday morning or Sunday afternoon after church. So we enjoy it. And Ghanaian food is really good, tasty. But the problem is the amount of oil, the amount of fried stuff, the age of the oil that they use to cook, and also the amount of calories. So we're going to look at what is the content of the food? How much calorie does it take? What is calorie? Calorie is basically the petrol you get from the fuel. I mean, from the food. The petrol the body uses, you get from the food. If it's too much, you wouldn't use all the petrol. So you save it. And then the place to save it is your buttocks, your chest, your backside, your arms, and you become big. So if you don't need a lot of fuel, don't eat too much. But the unfortunate thing is, the bigger you are, the more you eat.
That's what I was going to say.
The
Doc,
bigger you are, the more you eat.
Doc, I've been telling people this thing that, because people, sometimes ask, because I like to pick on a lot of things, so I end up eating a lot. I always tell people that it takes more fuel to fill the tank of a Tundra than it does to fill the tank of a Tico.
Exactly.
Thank you very much.
But you have to start going towards using electric current rather than fuel.
I love that.
So try to change your fuel, okay?
Your fuel source.
But it is something that we can work with. You could still eat, but make sure that the amount of food you're eating, the content of calorie is less. There's something we call glycemic index. Glycemic index. Glycemic index is how much sugar, literally, I'm just using the literal translation. How much sugar do you get out of that food you've just eaten? Okay. And if you look at the amount of the way our Banku has transitioned, the Banku of yesteryears is not the Banku of today. It's finer, it's adulterated, and you digest it quickly. Okay. How can you eat Banku and be constipated? Those years, you couldn't eat Banku and be constipated. Okay. There's no way you eat Banku and get constipated. These days, you eat Banku and you get constipated. You eat fine fufu and you get constipated. But so it's because it's become finer and we're able to take up all the calories from the Banku, and then we don't know what to do with it. The other thing is the time of eating, not just the quantity, but the timing. If you eat more in the morning, less in the afternoon, and not in the evening, you're better off. Okay. But guess what? A lot of people cannot sleep with an empty stomach.
Yeah.
Okay. So you will end up by eating late, which is bad. I'm a victim of that. So I'm not like somebody who is innocent. I'm a victim of it because I work too much and I come late and I have to eat late. But it is not good because as soon as you eat and go to sleep, you don't burn the fuel, you just store it. So change the timing of your eating, the quantity of eating, the amount of things that will give you fiber. That is the best thing. So vegetables, and if you don't like fresh vegetables, parboil it, heat it a little bit, add things that you like. You can add pepper, to salt. We use these white man's dressings. Why can't we create our own dressing? Why do you have to use ranch? Ranch really makes it tasty, but you just substitute the grass for a lot of fat and stuff.
All right.
So you can use a little bit salt and pepper, add some onions, grind it, and then sprinkle it over the leaves, and then it will be tasty. Add a little bit olive oil, and that's my recipe. You can do that and without increasing the calorie. Okay. The last one will be fatty food, milk products, dairy products. We don't do a lot of dairy products, but if you look at the amount of milk we consume, the concentrated milk, I don't want to name them, but you know what I'm talking about. It's actually a lot. Some people pour half a tin into their coffee. No, that is too much. So milk is not really good for us. Okay. So if we can cut it down, the better.
Okay. Right. Well, thank you very much for joining us this morning.
This has been wonderful.
Dr. Joseph Akama, you've made my morning. You started with the smile and you ended with the Tundra. So absolutely love it. Thank you so much for taking time out to spend with us this morning.
Thank you. Thank you.
You're welcome.
Bye-bye. Have a nice day, everybody.
You too. You too.
Bye.
We've been talking to Dr.
Yeah.
Joseph Akama, who is a You want to say something? You're not letting me finish.
No, before we go on it, because you brought the tundra and the tickle analogy.
Oh, it's tundra.
Yeah.
Hey, Barney.
Okay, so hold on. If you have a tundra and you're having to fuel it.
Please, it's not tundra. It's tundra.
You're having to fuel it with
The tundra.
with so much fuel. What you could also do is swap your tundra for a tickle.
Are you going to do that?
I'm asking you to do
Are you going to do that?
I'm asking you to do that.
Anyways, interesting conversation, but take care of your heart is really the takeaway. Okay, so we're moving on. I believe we're going to take a break. When we come back, we'll be having a conversation about the EcoBank Journeys Habitat Fair. This weekend, we're going to be having the 3rd mini clinic at the Junction Mall. And we're hosting roofing experts DBS right after this.